Hi, my name's Mike Gregory. As you probably know, we've been developing these products. Deo Dental have come up with these genius products, and we've now established a range of products which we can use for treating patients, teaching undergraduates and postgraduates. I work with Mustab at a teaching establishment, and he's kindly come along today to tell us his view of what he thinks about the way these products work and how useful they can be for teaching. So I think we start with we introduced Musab to the water chamber some time ago, and we gave this to you how many months ago?
I think it's coming up to almost a year now, I feel, yeah.
And you found it?
I mean, because I use it in practice very, very regularly, and as of just about yesterday, I used it as well on one of the patients. And especially in our kind of work, we get a lot of prosthetic patients, so using it for them to take impressions, I think has made life a lot simpler, because going on from previously when I studied and coming on to the clinics and things, there was always a cross-infection issue. How do we clean it, things like that. But this has solved a lot of those issues, and especially in an age where we don't want things that we throw. We just want things that we can sterilize, we can reuse. I think it has really changed the way I work.
How do your staff find using this in practice? Any resistance? Any sort of worries about they?
Oh, so I think for the first few times that they used it, they were pretty excited about it, that it was a new product to use. And I think because they can just put it in an autoclave very quickly, I think it makes their lives a lot simpler. Because what previously used to happen was I'm talking about only practice now, alternate bowl, getting a kettle on, putting the hot water in, and getting it to a point where it's reasonable, but we never knew what the temperature was.
Yeah.
And it was always like, okay, is the compound or is too hot? Am I going to burn the patient? So I was always checking the compound before putting in the patient.
And it sticks to your gloves if it's too hot. Compound, a horrible mess.
And it sticks to your gloves as well. So I think that has made, because we don't have to get the kettle in, and that kettle used to be from the kitchen. So there's always that, okay, do I want to be bringing this into my clinic? I never wanted to do that. So, I just put water in, leave it on. It makes my life a lot simpler.
Great, isn't it? Really good. Yeah, magic.
Yeah.
And now we've come up with this gadget, which I think you're really impressed with, aren't you?
Yeah, absolutely.
The hot plate.
I think because what we are using in practices and teaching establishments is the fact that we have these paint scrapers that we put the wax rim on and we melt it. And that's the bit that because we are adjusting it, it's always, we don't have finer control. In a teaching establishment back in the day, we had those old bits where we had that, but we couldn't find anything. We searched online quite a lot, but we couldn't find anything. So this has changed a lot, because I'm not now holding a paint scraper in my hand and trying to see how wax rims can be adjusted.
The flame roaring away, which practice managers always hate, don't they?
Yeah, absolutely.
And if you're teaching undergraduates with naked flames, slightly frightening.
I think naked flames, hands down, should ideally not be used at all in practice setting or teaching establishments for that matter. They are a hazard. So if I think the whole point of this is getting away from flames and things, and just making sure everything is done without that.
And talking of that, this is something you've not seen until today.
Yeah.
This is something you've not seen, I only saw today, and this is just a revelation. So this component here will heat up these things, and they retain the heat amazingly. It's like a heat sink. You put a piece of wax in there, you close it down, you put it on the bench top, and in less than 10 seconds, that's as pliable as a piece of wax.
Wow.
Just unbelievably easy to use. And there's two of these, so again, no naked flames. It's student proof. You put it in there, heat it up. There's two of these, you can take the next one out, put the wax in, 10 seconds, and you can use it.
Yeah.
So I don't know what you think, but something like that for undergraduates, just magic.
I think we talk about students here, but I think if we look at where, a lot of people who are coming out who've perhaps not done prosthetics in a while, this is quite important, because this takes you to the bare basics of things that, these are the basic things that we can always use. It's not something that needs skill, that you don't have to be a specialist or a postgrad to be using this. Simple things that you can use in practice, absolutely. And that makes a huge difference. The other thing that I've used, and we always talk about compound and things. The one thing when you're relining dentures, I put my denture in there. And because with the exothermic reaction, you want it to set, and it sets pretty quickly. So I just use that as well. So I think it's the more because you have it, the more you have the opportunity to use it for different things, and that's the main thing, really.
The other thing that's come to my realization recently is that this is analog dentistry. So if you want to use compound, you want to use green stick, you want to use wax, it's cheap to actually treat patients.
Yeah.
Whereas if you're taught with a scanner and you can't use analog dentistry, if you end up in the wrong place you work in, and you haven't got a scanner, you're stuck. Whether you've got this kit like this, of minimal outlay, really cheap consumable materials, costs next to nothing by comparison.
Absolutely. I mean, digital dentistry, is moving forward. Even with the denture side of things, we are moving forward. But I think there's still a gap in the technology side of things. I mean, and even with the people who are doing digital dentures, they have to do some kind of impressions and some kind of modifications at the very end. And again, these materials will be.
Of course, if your scanner packs up,
your
scanner packs up, dentistry can't stop.
Yeah.
So if you've got something like this, it works.
Yeah.
So, and again, I think you've seen the concept of this, heating up green stick.
Yeah.
No naked flames.
Yeah.
Just inject it onto the tray, temper it in a water bath, and off you go. So,
that
again, that's reducing the risk to anybody. No naked flames. And the thing with this is, it's the right temperature when it goes in the mouth. You haven't got to worry too much about it getting too hot, which is undergraduates definitely guilty of actually putting the mouth too hot, or conversely, they let it cool down too much, and then
it's not malleable.
then it doesn't work. So
yeah.
And then we got the mirror heater, which you do loads. I know you do loads of photography. How do you mirror heating?
At the moment, because I had not seen that, what I was doing is I was just putting it in there, without any water, without anything. Now, initially, what my nurse was doing is just filling this up with water and putting that in, because that would heat the mirror up, and then she would just wipe it and use it. But then one day we just left it without any water or anything, and it still worked. And that's the thing, because when you're taking photos, and I take photos of each and every step for teaching purposes, for recording each and every stage, and and that makes the biggest difference, that I don't have to go like, okay, she has to put in hot water, wait for it, and then clean it, and then come and bring it back to me. It just is simple. And that's a bit simplifying the procedure.
Because the other thing with cleaning the mirrors, you're dangerous scratching them.
Yeah.
Because the surfaces abrade really easily, don't they? And then your mirrors are in the bin, and you got some more mirrors.
Yeah.
So this makes your mirrors last longer as well. So you can't really go wrong, can you?
No, absolutely.
And I think you've been a fan of the concept of this, haven't you?
Yeah,
heated composite.
Because a lot of cementation, especially with the revolutionizing of, we barely do crowns anymore. Even when we're doing crowns, we're doing minimal preparations, and we're doing more onlays, that sort of things. And most of my onlays are cemented with heated composites. So getting the temperature, so what I had bought, I know there are a lot of companies out there which sell something where you can heat composite. I bought something of Amazon, which was 20 quid just to heat the composite. Did work, but the problem was, the temperature. What it's saying on it, is it the right temperature?
I did some experiments at home.
So
it's just miles off, isn't it?
Yeah, I mean, and that's the bit, right? So I'm like, is it the right temperature? So I was a bit guessing on that. And I think this is what changes it, because it does give you an idea of the temperature that it's at. And we have studies to prove, okay, this is the temperature the composite should be heated at. So that there's more predictability with regards to that. Now, I mean, I know here I'm talking about clinical and teaching side of things, but the other bit that people would not talk about is the research avenues from this, because when we do research side of things, we want everything constant, and we just
that's a good point.
We change one aspect. If the temperature is constant, there are a lot of avenues for research that has not been tapped into.
And the units available on the market, I think even more expensive ones, I wouldn't necessarily trust. Temperature-wise for stability, whereas this is just always there.
And that's a bit, the predictability of, especially the temperature, just making sure. And this is, not only composite, it allows you a lot more, doesn't it? I mean, this is the gun bit, but there are ampules on the inside.
So underneath you've got the option to put local anaesthetic in.
Yeah.
You put compules, you can put endo materials in there.
Yeah.
So irrigants and the like as well. And again, as we said before, the whole thing, cross-infection is not an issue, because all of this can go through a washer disinfector and an autoclave.
Yeah.
So you're compliant wherever you are in the world. It's just compliant with any regulations that might exist.
And I think the other advantage is I don't need to get 5 of these. And that was when we were initially looking at it, like, do I need like 4 of these for do I need separate one for this, separate one for that, separate one for this?
Yeah.
And I think that's what would have been cumbersome. It's like, I have to buy 5 different, kits, which is not the case really.
And now we've actually organised this. Dental is actually, we now got a program on the side. So you press one of 4 programs, and it just selects the program for the material you're going to use, and then you can moderate the temperature. If you want to, as again you said about experiments, if you want to do research, you can actually jack the temperatures up and down once you've got the unit, and actually test at different temperatures, and it's predictable. So yeah, it's great, good product.